Well, a recent Florida Department of Health report has shown that 98 to 100% of the COVID-19 tests are coming back positive. But according to the Department of Health, the statistics are because some private labs aren't reporting their negative results at all. And this has also been reportedly happening in other parts of the country. So what is the reason for these faulty COVID tests, and is the infection rate as high as the media reports? Joining us to discuss is Dr. Jason West, head of the world-renowned West Clinic in Idaho. Thank you for being with us, Dr. West.
You're welcome, and it's nice to be able to share some information of all the studying I've been doing.
Yeah, it's crazy. Every time you turn on the TV, places are reporting very high rates of positivity for COVID-19. Some are saying 98%, but really when they've done their investigations, it was 9.8% positivity. So how is this occurring, and what's happening, and how are they being held accountable for the false reporting?
Well, I don't know how they're being held accountable, but I will tell you just some practical sense on the patient side, because so many patients are calling up and they're saying, Dr. West, what should I be doing? What should I be taking? And I have a little joke. I tell them, well, you should be taking a break from the social media and the panic that's occurring. That's what you should take. And then the next thing that I tell everybody is, like, let's just kind of look at this as a little different way. I mean, one of the reasons I think you're getting so much false positivity is just thinking about how the coronavirus family, the family of viruses work. It's been in our system literally for millions of years. There's 4 strains of the coronavirus and that are relatively benign, and then there's 3 that cause disease. And even the CDC on their website says if you have a positive coronavirus test, it may be that you're COVID-19 positive, but it also means that you could have antibodies or been exposed to infection of the coronavirus family, which could cause the common cold. And I just have some real concerns that the testing is really that valid and it's that good. Like, I really question the numbers.
Yeah, Dr. West, that was news to me this week. Of course, I'm not a doctor. Dr. Bonatti probably knew this all along, but when I read reports, that to me, it's like, if you're testing for COVID-19, that's what you're testing for. So if it's positive, it's positive. But it was news to me that there's such a big family of coronavirus that it doesn't differentiate specifically for COVID-19. So you can get positives for the common cold, like you said. That was news to a lot of people, I think.
Well, it's true. And, you know, and it's so fascinating when I was looking at the data, the article link that you sent me, and preparing for the interview, of looking at the testing, it is just so concerning that everybody's positive. And then when you delve into the numbers, it's 9% or it's 90%. And part of me wants to just tell everybody, look, let's just accept that everybody's been exposed to the coronavirus. And then let's work on getting people healthy instead of having all of this panic about infection rates and stuff like that. Let's go back to the basics and say, okay, how can we make it so that we reduce symptoms, we reduce risk factors, and we bring health back to everybody, putting people in a place where they're not going to be exposed to it. And then as soon as they get back around people, then now we have an infection. That's not an answer. That doesn't feel like a solution to me. We need to be, hey, now's the time to fix your immune system and recognize, like, just accept it. You're going to get exposed to this.
Right. But you also see the push where they're trying to delay starting schools.
I think that there's so many different angles and agendas that are in play here, because when you look at the statistics, I just saw one out of Spain, and I saw another study out of the British Journal of Medical Practitioners that states that literally the infection rates or the possibilities for children is like 1 in a million. It's like 0.0001% of people under 45 are going to have a problem with this. And it just doesn't seem like what is being presented in science and in the journal is being picked up and being portrayed by the media. We're having all of this fear, and people can't even. I had a lady in my office yesterday that literally could not function because of all the panic that she was having for the coronavirus. And I'm like, look, we have to take a breath, and then we got to start looking at science and numbers, not hysteria.
I agree. Unfortunately, we're out of time, but thank you so much, Dr. Jason West, head of the world-renowned West Clinic in Idaho, being on to talk about the false positives of coronavirus testing. Thank you for being on the show.
Thanks, Dr. West.
You're welcome. Stay safe and stay healthy.
All right.
Take care.